The President said when he signed the bill I'm signing will set in motion reforms that generations of Americans have fought for and marched for and hungered to see, enshrining the core principles that everybody should have some basic security when it comes to their health care. Two good sources to find out more about Obamacare include a recent book by Jacobs and Skopal and the Kaiser Family Foundation. As a brief aside, it's interesting because if you Google Obamacare, you get all the radical right responses to the Affordable Care Act. If you Google Affordable Care Act, you get a totally different perspective. But it is true that the Affordable Care Act addresses four major problems: uninsurance, gaps in the government programs, the cost of care, and inequality. Now, nobody believes this is a panacea, but it is the first major health care reform we've had since the implementation of Medicare and Medicaid back in 1965. It will insure 32 million people who currently do not have insurance through expanding Medicaid. It will also help the uninsured by giving subsidies to small businesses and individuals with modest income to purchase private health insurances. These insurance exchange packages will be available from what are called healthcare exchanges that will be run by each state. Now, these healthcare exchanges are basically new marketplaces to purchase insurance. And both employers and individuals can purchase policies there. There will be a more level, competitive environment, and the government will subsidize these premiums, starting at those who make 138% to 400% of the federal poverty level. So basically, if a single person is earning less than $43,560 based on the federal poverty level for 2011, or a family of four is making less than $89,406, the government will subsidize premiums. Those are below the 138% will automatically be eligible for Medicaid. Insurance now has to cover children regardless of their health problems. So they can no longer be excluded from health insurance because of pre-existing conditions. By 2014, no adult can be refused insurance because of pre-existing conditions. And currently, anybody who has a child 26 or under who is dependent on them can cover them under the parent's insurance plan. It also will be the case as these changes go into effect that insurers cannot charge sicker people more money to buy health care policies. Just as drivers have had to have car insurance, almost all Americans will be required to have health insurance by the year 2014. Again, there will be subsidies for low and middle income people to buy insurance. Those who opt out of the insurance will have to pay an annual tax penalty, unless you can prove that to buy insurance costs more than it's covered here, but I think it's 9% of a family or individual's income. There are also incentives to insure more workers. So as of 2014, if you have 50 or more employees, you must provide coverage, otherwise you start getting assessed $2,000 per employee. Small employers can get tax credits for providing coverage, and small employers are those who have less than 25 workers. So more will be insured. It's estimated that 32 million people will have health insurance coverage by 2019. But another 23 million people, or 8%, will not be insured, including illegal immigrants, people who are exempt from the mandate because they can't get access to affordable coverage, and people who choose to pay the penalty. So, first thing is we're expanding to get the insurance. Second issue is that the bill will close some of the gaps in government programs. There are changes to Medicare that are very important, and they will eliminate the donut hole, and there's the expansion of Medicaid. Medicare will provide free preventive checkups and more subsidies for drugs in prescriptions. By the end of the decade, 75% of drug costs will be paid. So the donut hole will be eliminated. And the prices that will be charged for drugs for Medicare recipients will be drastically reduced. So the government is going to step in and start regulating those prices. Medicare will also develop personal wellness plans that identify an individual's risks that they need to reduce and lays out what tests need to be done that year. They will encourage coordinated care. They will seek to reduce hospitalizations in the elderly. And they will also develop protective services for the elderly to prevent elder abuse. Medicaid will be expanded. As I noted before, by 2014, every state has to include anybody who makes 138% or less of the federal poverty level and who's non-elderly has to be included in Medicaid. It affects all states. It would cover low-income adults who do not have dependent children who are currently not eligible for Medicaid. So those young adults who are just starting out in the workplace or who don't have a job or who are in graduate school can get coverage. And it will safeguard current Medicaid and CHIP enrollees so that they don't lose eligibility during this transition. It will reduce costs. It's going to reduce costs in several ways. First of all, it's going to stress prevention and avoiding disease. We don't spend enough money on prevention, so people are getting sick when these illnesses could be avoided. It also will ensure that people are screened on a regular basis so that we can detect diseases earlier. We can detect breast cancer before the lump can be felt. We can detect hypertension before somebody's blood pressure is off the wall. We can detect diabetes at an early stage. Many of the immunizations and screenings will have no co-pays or deductibles, so they're going to be free. And they're seeking to expand the pool of primary care doctors and nurses. And this is going to cost less because primary care doctors, who are defined as family practitioners, pediatricians, and internists, cost a lot less than specialty physicians. They're also going to try to expand the pool of nurses. Nurses who are nurse practitioners are able to deliver most of the care that a primary physician can deliver at much less cost. There are going to be incentives for efficient payments, for efficient to physicians and to hospitals. So if you can show you are efficient and you have saved some money, you'll get some bonuses. They're going to propose to start paying for results in health care. So instead of giving the doctor money for every test that he or she runs, they will reward the doctor if his patient or her patient with asthma visits the emergency room less because their asthma is better controlled. They will give doctors bonuses if their diabetic patients are under control and less likely to be hospitalized. If people with high blood pressure or hypertension are kept under control. So these incentives save the system money in the long run because patients are not so desperately ill, but they're